Hey guys, this is Dr. Hub. Today we'll look at the tympanic membrane. And before we move ahead with the description, let's draw a rough sketch and label the parts. This will help us in the further video. So usually when we draw diagrams, it's better to mark them as soon as we draw them. So this is the pars placida. Next is the post-malleol fold. Then comes the lateral process of the malleolus. Then this is nothing but the anterior malleol fold. So that was the posterior. This is going to be the anterior malleol fold. Then comes the handle of the malleus. And this is nothing but the umbo. This is the umbo, and here comes a cone of light. And then you have some outward striations for depicting. So this is all about the tympanic membrane, the major diagram. So we have the posterior malleol fold. So there is a posterior malleol fold. There is an anterior malleol fold. There is a lateral process of the malleus, there is pars placida, there is the umbo as well as the cone of light, and the handle of the malleus, very prominent. So this is about the diagram. Now let's look at each part. So let's remember this diagram and continue ahead. So looking at the parts of the tympanic membrane, first is there is a pars tensa and the pars placida. So let's look at pars tensa. So when you look at pars tensa, it is stout, and here the middle fibrous layer is well organized. So the middle fibrous layer, it is well organized. Next comes the continuous annulus tympanicus. The continuous annulus tympanicus. And what does the pars tensa do? It transmits sound. Now, in comparison to all this, let's look at the pars placida. So in terms of pars placida, it is loose. The pars placida is loose, and there is also middle fibrous layer is not well organized. So there is a middle fibrous layer, and this middle fibrous layer, it is not well organized. It is not well organized, and it is also known as the other common name, aka the shrapnel's membrane. The shrapnel membrane. So the other point to note is that it does not transmit sound. So there is no sound transmission. Whereas in case of pars tensa, it had a transmission of sound. In pars placida, it does not transmit the sound. There is no sound transmission. Now let's look at the layers of the tympanic membrane. So the layers of the tympanic membrane. So the layers of the tympanic membrane, first we will look at the outer layer. In terms of the outer layer, the layer is of the epithelium. And what is it continuous with? It is continuous with the skin of the EAC. It is continuous with the skin of the EAC. So what is it derived from? It is derived from the ectoderm. This is all about the outer. So it is the ectoderm. Easy to remember. And now we'll move on to the middle part, the middle layer of the tympanic membrane. So in terms of the middle layer, it is nothing but the fibrous. And what is it continuous with? it is not significant. So then what is it derived from? It is derived from the mesoderm, since it's a middle M and M, mesoderm. And what is it made of? It is made of the circular, there is the circular, there is a radial and the parabolic fibers. There is a parabolic fibers. So all this is what it is made of. Next we move on to the inner. So what happens in case of the inner layer of the tympanic membrane? So in terms of the inner layer, it is made up of, it is a layer of the mucosa. It is a layer of the mucosa. And what is it continuous with? It is continuous with the middle ear mucosa. It is continuous with the middle ear mucosa. And what is it derived from? This is very easy. It is derived, since it's the inner ear, it is derived from the endoderm. So this was all about the tympanic membrane. To begin with, we saw a diagram of the tympanic membrane. We labeled some important structures. Then we also had a differentiation between the pars tymparensa as well as the pars placida. And lastly, we saw the layers of the tympanic membrane. We saw the outer, middle and inner layer under some categories, such as what is it derived from, what is it made of, and what is it continuous with. So to learn and grow daily like this, please do subscribe.